Hi, my name is Morgan, and I'm going to be your student nurse today. Today we're going to be doing the head-to-toe assessment, and the head-to-toe assessment is just to test your general overall health. Would you please verify your name and date of birth?
Isaac, January 23rd, 1999.
And can I check your wristband? Alright, looks good. I'm just going to ensure some privacy for us, and anytime during the head-to-toe assessment, if you feel any pain or tenderness, just jump in and let me know. So I'm going to start with your head. His head is normocephalic with no visual deformities. Upon palpation, there are no masses or lesions or any tenderness. So now I'm just going to test your facial movement. So I'm going to have you close your eyes shut, wrinkle your forehead, puff your cheeks, smile, clench your teeth. Okay, the patient's cranial nerve 5 and 7 are both intact. The patient was able to do the facial movements with no problem, and there was no involuntary movement. So now I'm just going to have you close your eyes, and I'm going to test your taste. All right. And what do you taste?
Milk.
Okay, the patient's cranial nerve 7 is intact. The patient was able to correctly identify the taste of the mint. So now I'm just going to palpate your frontal and your maxillary sinus. This is his frontal and this is his maxillary sinus. Was there any tenderness or pain? Okay, so there was no inflammation or tenderness on the frontal or maxillary sinus. So now I'm just going to move to your eyes. Your eyes are round, both your eyes are round, your eyelids are approximated, and your pupils are at about a 5 millimeter. So now I'm just going to do the diagnostic positions test. So I'm just going to have you follow my pen light. Okay, the patient's eyes moved equally to cross. There was no nystagmus noticed. The patient's cranial nerves 3, 4, and 6 are all intact. So now I'm just going to have you look straight ahead, and I'm going to come in from the side. All right. Okay, both of the pupils constricted bilaterally, and it went from a 5 millimeter to a 2 when it constricted. Now I'm just going to do the accommodations test, so I'm just going to have you look off. Now look here. Okay, the patient's eyes were able to focus on my pen light, and his cranial nerves 2 and 3 are both intact. So now I'm just going to check the optic fundus, so I'm just going to have you look at me. Okay, the red reflex light is present in both the eyes symmetrically. So now I'm just going to move on to your ears, and I'm going to inspect. His ears are symmetric, and now I'm just going to palpate. Okay, his ears are symmetric and there's no tenderness noted. And I'm just going to have a look inside your ear canal. Okay. Okay, the cone of light in the right ear is at 5 o'clock and in the left ear it's at 7 o'clock. There's no obstruction noted. And the temporal membrane is a light pearly gray color that is slightly concave. So now I'm just going to test your hearing. So I'm going to have you close one ear, and I'm going to whisper something, and you just repeat after me.
Okay. 5, 7, H.
All right, and your next ear.
SU2.
Okay, the patient's cranial nerve 8 is intact. The patient was able to repeat the words that I had said. So now I'm just going to do the Weber test. So I'm going to use my tuning fork, and I'm going to put this over your head, and you let me know if the sound goes to one ear or the other. There's no lateralization noted. So now I'm going to move on to your nose. While inspecting your nose, his nose is in midline and symmetrical. Now I'm just going to check your patency. So I'm going to have you occlude one nostril, suck in, blow out, and then occlude the second nostril, suck in, and blow out. Okay, there's no obstruction in the nose, and his nose has good patency. So now I'm just going to have you close your eyes, and I'm going to test your sense of smell. And tell me when you smell it and what you smell.
Alcohol.
Okay. The patient's cranial nerve 1 is intact. The patient was able to correctly identify the alcohol light. So now I'm just going to move on to your mouth. I'm going to have you open your mouth for me. Okay, thank you. The patient's soft and hard palate are both pink and moist, and the buccal mucosa is also pink and moist. The uvula is in midline, and the tongue is pink and moist, and the frenulum is pink and moist. And the posterior pharynx is also pink and moist, and the tonsils are at a grade 2+. So his dentition is, his teeth are white and evenly spaced with no dental caries. So now I'm just going to test your gag reflex. His gag reflex is present, and so now I'm just going to look inside your mouth and have you say ah. Okay, his uvula and soft palate both have his uvula and soft palate rows with in midline. So his cranial nerves 9 and 10 are intact. So I'm just gonna have you swallow for me. Was there any pain? And there's no pain during swallowing. So now I'm just gonna have you do a speech test. So I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
Okay, the patient's cranial nerve 12 is intact, and the patient was able to clearly say light, tight, dynamite. So now I'm just going to move on to your neck and let me know if any of this is painful. Okay, the patient's trachea is midline and non-tender. Now I'm going to move on to your lymph nodes, so let me know if any of this is painful for you.
Okay.
Okay, I'm going to palpate your preocular, postocular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical, post-cervical, and supracervical. Was any of that painful?
Mm-mm.
Okay, so his lymph nodes are non-palpable and they are non-tender. So now I'm going to move to your carotid artery, and I'm going to palpate both sides. Okay, when I palpated, the contour is smooth and the pulse is felt bilaterally. So now I'm just going to auscultate. I'm going to auscultate. Okay. Okay, breathe in for me. And out. Breathe in. Okay, there was no bruise heard, and it was at a +2 bilaterally. So now I'm going to move on to your skin. His skin is consistent with his genetic background with even pigmentation. And I'm just going to check your turgor with good elasticity. So now I'm just going to feel your temperature. Okay, his temperature is warm bilaterally. And now I'm going to move on to your respiration and cardiovascular system. So his AP to transport ratio is 1:2, and his breathing is unlabored. So now I'm going to have you turn to the side and lift your shirt up. Okay, so I'm going to have you breathe in, then breathe out. Okay, my hands moved apart symmetrically. So now I'm going to osculate his lungs I'm going to start with the anterior, so just in the front. So, all right, so I'm just going to have you breathe in and out. Okay. Out. In. Out. In. Out. In. Out. Okay, and I'm going to have you turn to the side and lift your shirt up. Okay. Out. Okay, you put your shirt down for me. His breathing was normal and hollow, and he had resonance breathing, which is normal. So now I'm just going to listen to your heart sounds. And I'm going to start with your aortic, which is in the second intercostal in the right sternal border. Then I'm going to move to your pulmonic, which is in the second intercostal space in the left sternal border. Then I'm going to move to your tricuspid, which is in the fourth intercostal space in the left sternal. Then I'm going to move to your mitral, which is in the fifth intercostal space in the left midclavicle line. All right, so I'm going to start with your aortic. Lift your shirt for me. Okay, this is your aortic, pulmonic, tricuspid, and mitral. Okay, S1 and S2 sounds were heard in all the spaces. and they were all, so S1 and S2 were heard with no murmurs or no extra heart sound. I'm just going to move on to feel your pulses. So I'm going to have you cup your hands like this, and I'm going to start with your brachial. Okay, now I'm going to move to your radial. All right, so now I'm just going to have you put your feet in frame so I can do your dorsal medius. Okay, so now I'm going to go to your posterior tibulus. Okay, it was, for all the pulses bilaterally, it was all a 2+, which is normal. So now I'm just going to assess your capillary refill. So I'm going to start with your upper extremities so I can see your nails. Okay, good. Now I'm going to move to your lower extremities. Okay, his capillary refill is normal. His color returned within 2 seconds. So now I'm going to move on to your abdomen. So I'm just going to have you lay down and pull your shirt up. All right, his abdomen is straight with no protrusion or distension. So now I'm just going to osculate the 4 quadrants. Okay, there was a high-pitched gurgling sound noted, so now I'm just going to percuss the 4 quadrants. Okay, there was a tympany sound noted on all 4 quadrants. So now I'm just going to palpate, and I'm going to start with a superficial, then I'm going to move to deep palpation. Let me know if any of it is tender. All right, I'm going to move to deep. Is any of that tender? Okay, during palpation there was no abnormal masses or lesions or bumps or anything, and it was non-tender. So now I'm just going to move on to the musculoskeletal system. So I'm going to have you sit back up, and we're going to check the range of motion. Okay, so we're going to start with your neck. So I'm going to have you look down, back up, look to the left, look to the right. Okay, he has full range of motion in his neck. So now I'm going to have you do your arms. So I'm going to have you extend, flex, put your hands out, do supination, now pronation. Okay, he has full range of motion in his arms. So now I'm going to test the range of motion in your legs. So I'm going to have you extend your legs. Now flex your legs. Okay, now I'm going to have you stand up, and we're going to do your spine. So I'm going to have you reach down. Okay, back up, and then to the side, and then to the other side. Okay, my patient has full range of motion in his neck, his arms, and his legs, and his spine. So now I'm just going to do the muscle test for you. So I'm just going to add some resistance. So I'm going to have you extend your arm, and now try to flex. Okay, I'm going to do your other arm. Now flex for me. All right, now I'm going to do your leg. Okay. Okay, the patient's muscle test strength for his arms and his legs are at a grade 5. So now I'm just going to do your shoulders. So I'm going to have you shrug up against resistance. Okay. The patient's cranial nerve 11 is intact. The patient was able to move his shoulders up without any limitations. So he has full range of motion in his neck. So I'm going to move on to the neurologic. So I'm going to have you stand up. Now I'm going to have you do the Rumberg test. So I'm going to have you close your eyes and put your feet together. Okay. Now I'm going to have you just walk 20 feet. Now come back. All right, so now I'm going to have you do some tandem walking, which is just having one foot in front, heel to toe. Okay, thank you. You may sit down now. Okay, for the patient's gait was normal. He was able to walk around and avoid obstacles easily. He had full range of motion while walking. He tested negative for the Rumberg test. He was able to stay straight with his eyes closed without swerving to the left or to the right or falling down. And for the tandem walking, he was able to walk straight and had good balance. So now I'm just going to test your coordination. So I'm going to have you touch your nose and then touch my finger. Okay, and then the next finger. Okay, this patient has good coordination. He was able to smoothly and accurately touch with both fingers on both hands, touch his nose to my finger. So now I'm just going to do the stereognosis test, which I'm going to have you close your eyes, and I'm going to see if you can identify this object without seeing it.
Screwdriver.
Okay, very good. Also, I'm going to do the pain test for you, so I'm just going to have you keep your eyes closed, and I'm going to have you tell me if this is a dull touch or a sharp pain.
Sharp. Dull. Sharp. Sharp.
Okay, this patient was able to correctly differentiate between light and dull touches. And this concludes the end of our head-to-toe assessment, and you are free to leave. Thank you.
Thank you.